Well, hello everyone. Welcome to this week's LinkedIn Live. We're also live on YouTube and on Facebook, so thank you for joining us, everyone. My name is Claudia Garcia, and for over 15 years, I have worked as a consultant with hundreds of healthcare professionals from private practice launch and growth strategies to staffing solutions for growing organizations. Every week, I host a LinkedIn Live with a healthcare professional to highlight all the great things that they're doing in the industry. It's also a great way to get the network to have access to new resources and new associations that may help them along their career path. Today, I am honored to have my guest, Dr. Stephen Ferrera, a DNP with over 20 years of clinical experience. He currently serves as the president of the American Association of Nurse Practitioners and is the inaugural Associate Dean of Artificial Intelligence and professor at Columbia University School of Nursing. He's also the editor in chief of the Journal of Doctoral Nursing Practice. Wow, that's a lot. That's so exciting. You're working with AI. I can't wait to jump into all that. Well, welcome. Thank you for joining me this morning.
Claudia, thank you so much for having me. I'm happy to be here.
Awesome. So, well, first things first, let's hear all about the association, what it's currently doing, and how nurse practitioners can benefit from joining the association.
Sure. And thank you for the question. So AANP, the American Association of Nurse Practitioners, is the voice of the nurse practitioner. So we have members from all different nurse practitioner specialties, from family nurse practitioners, adult, acute care, and women's health, and psychiatric nurse practitioners. And we are a professional membership organization. We are there to support new, current, and future nurse practitioners. And there's a host of benefits that people can enjoy. Some is discounted or free continuing education. And
Okay.
continuing education is required for our board certification, and we have to have certain number of hours every certification period. There's conferences. We have an upcoming health policy conference in Washington, D.C. at the end of February. And then we have our national conference in June, and that will be in San Diego this year. So lots of hours of continuing education, networking, and just a good way to maintain those hours, but also growing, your network as a nurse practitioner. There's a student nurse practitioner category that's discounted. So if you're a student NP, we want you to join too. And then, of course, for NPs who exist out there, we support all nurse practitioners as well. So continuing education is just a portion of what we do. There's also advocacy. There's research that AANP does on the nurse practitioner profession, as well as opportunities for leadership and getting involved with all things NP. So there's something out there truly for everyone.
For everyone. Awesome. Now it's a national association, correct? And you did mention all specialties. Are there any segments, for each specialty, or are they plugging in to a large pool of specialties, or is there anything specific there for each specialty?
Yeah, it's a great question. So actually, as of last year, we're international now. So we opened up our international category because we know that the nurse practitioner movement that started in the US in 1965 is also global. And there are other countries that are looking to us and to other countries that have nurse practitioners to say, how can they best start this new specialty? So as far as specialties are concerned, we have a category of communities that nurse practitioners can join that is either aligned with their own specialty focus, like a family nurse practitioner. But there's also categories that they can join that they want to be more interested in, such as primary care and acute care. There's an entrepreneurial category for those nurse practitioners who are thinking about starting their own practice or want to learn more about the business of healthcare. So there's really, again, I hate to sound cliche, but there is something for everyone
Sure.
who wants to be involved.
Awesome. So speaking of those nurses who want to start their own private practice, it's exciting because there are now 27 states that acknowledge full scope, right? Full practice, and are allowing them to work independently. And that's exciting. So is there anything that we should know about that? Or how can a nurse, what should she know before going and starting a practice?
Yeah, it's going to be being familiar with the state laws that
Mhm.
you are either living in or that you want to be licensed in. And that's critically important because, unfortunately, what we could do as nurse practitioners varies from state to state.
Okay.
We're all educated to do the same thing. We're all prepared to do the same thing. But what we can actually do is dictated by the state in which you're licensed in. And you mentioned the 27 states that have full practice authority. Our goal is to make sure that patients have a choice, that if they want to see a nurse practitioner for their care, they can find one and have that nurse practitioner provide that care in their specialty area. And, there's no fundamental difference between a nurse practitioner in a full practice state versus one in a non-full practice state, but what their ability to do is going to vary. So that's what we are striving for, and we will continue working hard.
Okay, so they need to get to know the laws within the state in which they're going to practice. Okay.
Yeah.
And do y'all help them with navigating those things? Does the association have any type of mentorship or, what kind of help do you have for somebody that is going to start their new practice?
Yeah, absolutely. So there's a number of resources that are either state specific, that is accessible for members only, and they can download these fact sheets and have all the information in one area. What is really challenging, and we've seen telehealth grow, right? Telehealth is growing. And you could be physically in one location, right? Like I'm in New York right now, and I have full practice because I have more than 3,600 hours of experience. But if my patient is in another state, I have to be licensed in that other state, and I have to follow the rules and the laws of that state. So it really is challenging, and conceptually doesn't make sense. I'm no different to a patient in New York than to a patient in Texas, say. What I could do is going to vary. So yes, there are resources available for members. And I mentioned there are the communities that the nurse practitioner members can join and find out more information about, specific opening up a practice, or, some knowledge from people who have already done that. And it's quite a lively discussion.
Oh, that's great. Now, you mentioned that there are also some conferences that they can attend this year. And can you tell me a little bit about that? And as well as the piece where y'all are doing some things to change legislation and to keep laws updated for the nurse practitioner. Can you share a little bit about that?
Sure. So we generally have one large conference a year, and that's what we call our national conference. That usually takes place in June. And this year, we're going to be in San Diego. We have hundreds of sessions available, concurrent sessions that are available for nurse practitioners that range from, beginner level to expert. And it's a good way to get that continuing education. We also have a health policy conference that takes place in Washington, D.C. And it's a conference that starts out with, a few sessions talking about health policy, which is one of my areas of passion, and ends with actual visits on Capitol Hill with your federal legislators that are, responsible for passing laws. And AANP works both at the state and federal levels, and there's barriers for nurse practitioners on both of those levels. And what this conference primarily focuses on are those federal barriers. And I'll give you a quick example of a federal barrier. for nurse practitioners, for our patients who have Medicare. Now, Medicare is insurance that over 60 million Americans have, and it's the same insurance for Medicare whether you live in any state. Nurse practitioners can't actually prescribe diabetic shoes for our patients with diabetes. Medicare law only recognizes a physician to be able to write that prescription and have it paid for by Medicare. This is something that needs to change. We're talking about a supportive shoe that allows a patient to have more comfort and more support, and so they don't get foot injuries, because we know that diabetes, a patient is prone to having vascular issues and some issues, and they can lose a toe or lose a foot. This is a common sense intervention, but the nation's 385,000 nurse practitioners cannot prescribe. So it takes a law. And so we are going to be on Capitol Hill. Amongst the things we will be asking legislative support for is the ability to prescribe these shoes and have Medicare pay for it.
I'm just curious. So there is a nurse practitioner that has their own practice. They see Medicare patients, diabetic patients. They're in a full, you call it full authority, right?
Full practice authority, yeah.
Full practice authority. And they can't prescribe these shoes. So what do? Do they have to then refer the patient out?
They have to refer a patient to a physician who is the only one who could write that order. Now, some states have, required contracts. The non-full practice authority states have, that nurse practitioner needs to have a contract with a physician. So oftentimes they'll refer that patient to that physician. But it delays access to care. It delays that patient from getting that resource that they need, and it just doesn't make sense. And there was no intent to prevent nurse practitioners from doing this. It's just that when the law was written, it didn't include nurse practitioners, and it needs to be amended, and a new law has to be passed in order for them to change it, and it has to be signed by the president of the United States for it to go into effect. So, it's not easy to pass legislation, and that's intentional, because then otherwise there'd be all crazy laws that we'd be passing all the time. But this is something that just makes so much sense, and our patients are truly the ones who, have to have some barrier in order to be getting this intervention. So it really hits home. And that's why we're going to be telling our stories in Washington, D.C. to those legislators, to hopefully for them to correct this problem.
Well, thank you for all that you're doing for nurse practitioners. And it sounds like you guys are fighting almost some silly battles, but you're fighting really hard for them. And there's exciting things to come for the nurse practitioner who is launching their own practice. So now let's dive into something that everyone's talking about, artificial intelligence. And how in the world did you jump into this? And like, what sparked the curiosity in you that said, hey, I'll take this. So yeah, go ahead.
It's interesting. I've always been tech, I'll say savvy, right? I've always been interested in technology, but never formally. And it's funny. One of our priorities at Columbia University has been strategic initiatives, has been AI and integrating AI into all areas within the university. And the story goes, our dean had suggested that her intention was to hire somebody to lead AI efforts at the school. And the joke is, I volunteered to be on the search committee, and that's how it goes. And here I am. So I'm fortunate, and while I don't have a formal background in informatics or technology as in training, it's my health policy background that's so salient, because it's all about health policy and how do we integrate this technology into providing care for patients and having it assisting clinicians to provide care. So it's really, really interesting, and it's exciting. And I truly believe that this technology will help us to not only have better patient outcomes, which is the name of the game, which is why we do this. Of course, we want to take the best care of our patients as possible, but I believe it can also reduce the administrative burden that plagues so many clinicians by having to do the paperwork or the computer work. And it'll help us get away from that and spend more time in front of our patients doing the things that we do and enjoy the most.
Yeah, I was just going to ask you that. Where do you see AI making the biggest impact for a nurse practitioner and for our providers, our physicians? Where do you see that that impact?
Yeah, the biggest area right now that exists is in what we call AI scribes. And this is technology that, has some kind of listening microphone and is able to transcribe that visit between the nurse practitioner, the physician, and the patient and put it into a note format so that the clinician doesn't have to type everything and click and everything. And if that's all we get from AI, that's a great thing. But there's so much more potential. There's clinical decision support that and that exists already, but it's not necessarily powered by AI. So AI is going to help us go through the voluminous charts that we have and be able to extract the important information that a clinician needs in order to make decisions and jointly with the patient. The other area that I'm excited about is in the wearable technology. A lot of us have Fitbits, Oura Rings, Apple Watches. Yeah. What do we do with that data? Right now, we're not doing anything with that data, truly. You get the data, it lives on your phone. But imagine being able to share that information with your nurse practitioner and being able to take actionable steps based on that information. So I think that's all what's going to come in the future. Right now, we're only skimming the surface of what AI could do in healthcare.
Oh, that's awesome. That's awesome. So right now we see it really in the administrative area to support. And do you see it going any further? Are we already talking about robots in the OR and things like that?
Well, they do exist. Robots do exist in the ERs, and there are some robots that are assisting and delivering medications to patient on the units in hospitals. So yes, we are seeing that. But here's where we have to be very mindful, right? We don't want AI to take the place of a licensed individual. And, we always want to ensure that there's a human in the loop whenever there's something AI generated. Nurses have the most trusted individuals. When the Gallup poll does that survey, nurses come out as the most trusted professionals, and we want to maintain that trust with our patients. And I think there's a good way to have mistrust if humans aren't being the ones calling the shots, right? Because at the end of the day, we're still human beings, and nuances to everything. So we want to be mindful and not have AI take the place of a nurse, of a physician, but we want AI to assist us in making our jobs more manageable so we can provide that care to our patients.
Absolutely. We don't want to lose the human touch, and I don't think the patients want that to go away.
Agreed.
Well, thank you. Let's see. We have some comments. We have Dr. Ferrera. She is saying, let's see here. Oh, she posted. She said a lot. So here, she's your biggest cheerleader. Awesome. Yes, so she is saying that she would like to be a speaker at AANP. I think she'd be great at it.
And I'll tell you on that point, AANP every year puts out a call for presenters. And be on the lookout for that. And if anybody's interested, contact me. I'll point you in the right direction. Unfortunately, for this June, speakers have been selected because it's a year-long process. But definitely be on the lookout at the AANP website for the call for presenters, or if you want to get in touch with me, I'm happy to share that resource.
All right. So we have Nurse Ava listening in. Hi, Ava. Thank you for joining us. We have Dr. Nguyen, who is also a DNP. Hello. Let's see who else. Sorry, there's so I can't see the YouTube ones. It looks like I could just see some of the LinkedIn ones, but if we missed you, we will definitely say hello in the comments. I am going to leave the association's information also in the comments, so that for anyone that's interested in joining or taking a look at the latest resources, that information will be there. And Dr. Stephen, is there anything that you would like to close us out with? Anything that we should know before we let you go?
Yeah. Well, again, I thank you for the opportunity, Claudia. And I can't emphasize enough the importance of what professional membership organizations do every day on behalf of our profession. They are the eyes and ears, and we're comprised of members, right? So, we want to understand what the needs are of our members. We want to offer resources and support. And I know, there's the idea is, well, I could do my networking on my own. I don't need a professional organization. But just think about, we have our staff in Washington, D.C. every day, making sure that as laws are being, or as bills are being written, that there's an inclusion for nurse practitioners, and that, we're making sure that we're educating the public about what it is we do and what we're capable of. So it's a great way to get involved. And, I just can't speak highly enough. I mean, I am president of AANP, but I have long been a member. Nobody forced me to join. And it really has been fulfilling professionally for me to be able to have this network of people that I'm just thrilled to work with, and hopefully, improve the profession so that we're able to offer everything we can for our patients.
Well, it sounds like you're already doing it, and you're doing such a great job. Thank you again for your time. And I guess the nurses will see you at the conference.
Yes.
And I'll actually be a panelist at Dr. Ferrera's conference if anyone wants to see me in Tampa. I'll be there. But thank you, guys. Networking is so important. I do believe in attending those conferences. So get to your AANP conference this year, connect, plug in, and I believe it's going to do really good things for you in your career and your business. Thank you once again. We're all so inspired, not just with the ability that nurses now can practice, but also that AI is going to help them and assist them in their administrative burdens, which everyone loves. So thank you once again, and we'll talk soon.
Thank you. Thank you.
Thank you, everyone.